So you probably have a wire loose. That's why it's flickering, or you have a bad wire out to your camera. I'm not sure. But anyways, let's go over the documents and everything and kind of see where we are. Okay?
Okay.
You can hear me?
Yeah.
Okay. Okay. Let me pull this over here. Okay. So, all right. Since the last appointment, you stopped the fish oils, reduced consumption of food high in choline. It's because your TMAO levels are high. Looks like they are back to normal. Okay. I'm glad you caught the methyl SP had choline because that would have been bad. Evening Primrose you're taking, we're waiting for the other test, and you're doing the heart math. Um, you are taking the B12 and methylcobalamin and sublingual tablets or not? Are you?
I have not been. No, I bought it, but I've been feeling so unwell. I have to be at some level to risk the aggravation. I've been so low that I couldn't really afford trying trying that. I did buy. I found it on Elevate, but yeah, I did not start
You're
taking.
not start taking it. Okay. So just to kind of recap here, like I know you've had some difficulty the past few weeks, but your typical what you call signature attacks, like the fatigue, the weakness, all
Mhm.
those symptoms are pretty bad right now. Or give me.
Yeah. See, there are signature attacks, and then there is general background, right? So signature attacks happen all the time, no matter the background, how fatigued, how achy, how overwhelmed I feel, right? So lately I have been both. The background is very bad, and signature attacks increased.
Okay. It would say signature attacks. I mean, there's a lot of symptoms you classify as under signature attacks. But yeah, burping, mental fatigue, insomnia, you know, voice changes, weakness, all
Right.
those,
Yeah.
all those symptoms.
Yeah, this is what signature attacks come with nowadays. But besides the signature attacks, there is this what I call background,
Yeah.
where I'm still fatigued. I have lots of pain everywhere that kind of dances all around my body, and insomnia and headaches. Well, this is pain, and lots of other symptoms. And then comes signature attacks with their punch.
Okay. So, you know, the goal right now, we're still on optimizing your vascular health and reducing expression of microvascular disease, dampening neuroinflammation from microglial weakness. Because anytime you have acute onset of symptoms that trigger, it's either vascular or immune. And I mean, the ongoing persistent fatigue could just be you just don't have enough endurance. You just have, you know, mitochondrial dysfunction in your brain at this point.
I do believe so.
So those two things, I think we're still trying to look at all your risk factors for the triggers. I'm not sure if you're symptomatic. Our goal is to kind of reduce the mechanisms that could be causing injury, not necessarily immediately expecting you to have symptom change. Obviously, we want you to do better. Now, let me ask you a question. You've been very sensitive to stress, and I know like the Ukraine war is something that in the past you told me is very stressful for you, especially as you're hearing things. How are you with your blood pressure? Because I know when you first were keeping the blood pressure journal, your blood pressures were in the 140s at several times throughout the day, like in that little hypertension state. Have you been checking your blood pressure? Have you noticed what's your stress?
No, no, I have not been since our last appointment. I did not understand. See, checking blood pressure also comes with increased pain because remember how I was shouting in your office when you were checking blood pressure in my leg, lower right leg.
Yeah.
And this, it was extreme. But when I'm checking blood pressure, because of that pain, fibromyalgia, or whatever it is, it aches me when I'm taking blood pressure. And since you did specifically tell me you will continue it, I was happy to stop it. I kind of thought maybe we have to the general picture. What I can tell you though, I've been checking here and there, and My understanding is still pretty much the same, except that when I went to the dentist last week, it was 173 over 101. And
Okay.
she kind of got scared and scared me. This is like the highest recently. Even in your office, I didn't have it that high. Then, like an hour later, she checked it and it was 150 something.
That's still high.
But the thing is that I was very sick that time, and it's like I did want to go to the dentist because I really needed to, and I pushed myself. So I understand that I just needed so much adrenaline, so much stress hormones to give me the strength to make that trip. That this is what raised my blood pressure. What is concerned about like this heart mass. I did it last time. It was 100 coherence. There was no yellow or red. It was all green. So my nervous system is calm. When I started, it was 80 to 20, 80 coherence and 20 not in coherence.
But you're
So
looking at heart rate with heart math. We're talking about pressure in your arteries.
yeah, it's just that I'm kind of like reflecting on that, why my blood pressure was so high in the dentist's office.
So listen, what are your thoughts, Vera, about blood pressure medication?
I don't like the idea. But you think I need to?
Well, obviously, I think we both have similar philosophies where we don't want to use medication unless you have to.
Right.
I'm just so concerned that if you're having these, past MRIs, you had three of them where they keep showing these white matter hyperintensities and microvascular patterns, that when you're getting your blood pressure high, and it doesn't have to be high for long, it just has to be high for a few seconds, and then you can get some rupture of arteries. Mm-hmm. And then you can get your signature attacks and symptoms to come on, that we're not able to, we still are looking at the neurochemical things that can injure your arteries, like homocysteine and TMAO and all that. But the most destructive thing to microvascular disease is actually the increase in pressure in the artery. So it's kind of getting to the point where it's almost like scary if you don't.
I understand. So let me understand it properly. So most of the time my blood pressure is okay.
Yeah.
Sometimes, and pretty much by the end of the day, when I'm so very tired, kind of like my energy falls down throughout the day together with that cortisol.
Yeah.
So it usually rises, not always, and never this high, like 170. I did have it like 180 when I went to the emergency room, except at that time I had such a headache. I thought that my head would burst.
Yeah.
And I was shaking.
Yeah.
And when I went to that emergency, they checked me out and they told me I'm fine.
Yeah. So the thing is, hypertension doesn't mean you have blood pressure high every minute of all day. You just have spikes that are high, and then over time, you can have some changes. Now, I remember when you made the journal for me, we were looking at your blood pressure, and then, you can see the hypertension off and on throughout most days. So like right here, boom, 146 with weakened blood vessels, you could have a signature attack right there. Anytime your blood pressure spikes up, especially if the blood vessels are weakened, you could have some insults. Now, when you start to get in the 170, 150, that's all it takes. And, these are just you knowing you're going to take blood pressure. But if you have something very emotionally stressful, and we know stress activates your symptoms, then you get acute onset of signature attacks, which are all clearly neurological symptoms. It's just a concern that you may really be a candidate for hypertensive medication. And we may be wasting way too much time trying to find nutritional ways to lower your blood pressure. You've already done many things. And it's something you really have to consider, you know. Um, if
So,
if I was in your position, I would strongly consider it, even for a trial period, just to see how things are. Now, listen, blood pressure medication isn't likely going to make you have no fatigue because there's injury to the brain, I believe, and there's inflammation in the brain. But if it's working, you would have less frequent signature attack responses because the working theories of signature attacks are little microvascular injuries. And then what will cause
except that I was not having a signature attack even with 170. I didn't feel well, but that was not a signature attack. I kind of do not connect signature attack with blood pressure.
Yeah, I don't think it's going to be as black and white and as clear as you think it's going to be. Do you know what I'm saying? Because you could have an attack and a response and have inflammation and have symptoms just later. You're not getting a massive occlusion. You're getting a little rupture. A little rupture then creates a cascade of inflammatory responses. You may have symptoms later. So if you're looking for like that direct linear relationship, I don't think you're gonna find it. Now, listen, you can start blood pressure medication and you can always stop, right? But it's something that, and you probably should have be monitored with the like a 24-hour blood pressure monitor. They can just see what your blood pressure readings are over time. You're gonna just have to deal with the pressure in your arm, to get the accurate diagnosis and make sure your blood pressure is managed. I mean, there's no way you can have all the MRI findings and clinical symptoms of microvascular disease and ignore episodes of high blood pressure throughout the day.
I understand. Okay, so do you suggest I talk to my general practitioner to see whether he will give me the medication, right?
You probably need to be referred out to a cardiologist, but see what your general practitioner says. Just say you're concerned about hypertension and you want to see if you can get under control,
Okay.
Yeah.
I'll do that.
Okay, so that would be like one of the most important things. Like if you look at your overall health and you look at your age, and we're already seeing like some areas of atrophy on the neuroquant MRI, and we're seeing these inflammatory brainstem, these inflammatory lesions all throughout the brain that are associated with microvascular disease. Getting your blood pressure under control is one of the most important things you can do. Okay, and so that's like, I just want to make sure we emphasize that. And if you can keep me posted on what you end up doing that. The ideal scenario was you would see your primary care would refer you to most likely a cardiologist, or they themselves would do like a 24-hour blood pressure monitored test on you, monitor your blood pressure for a day or even longer. And then you might have to experiment with different types of medication if you're open to that, to see if they can lower your blood pressure. And then once your blood pressure gets lowered, just to see what's happening to your symptoms over the next few weeks and seeing if the frequency of some of these episodes are going down.
Okay.
And if it doesn't work for you and you have reactions, you can always not do it, but it's something you can, you have to know about.
And do I understand it right that when the blood vessel breaks, it is a stroke, right?
See, they're actually, the word that you use sometimes is silent stroke, because the symptoms could be so subtle, and some people don't have any symptoms at all. So that's the thing with microvascular disease. They're very subtle symptoms or even silent at times. So you wouldn't expect to have, most people that get like what people consider a stroke are going to have immediate deficit. They're going to have like spasticity of the arms. They can't speak. They can't do that. But that's with larger vessels. With small vessels, the little tiny branches that are coming off the blood vessels, you could have signature attack symptoms you have, or no symptoms at all.
So you're saying that the regular stroke, this is not what might happen to me with this blood pressure and this.
It's possible. You could, when you have microvascular compromise and microvascular health, you could end up with a actual, embolytic stroke, or you can actually have dissection of your blood vessels and have a massive stroke. You would
Okay,
definitely.
because stroke is something I do not want to deal with. I'd rather prefer a heart attack and death, but this is not what's likely to happen. A stroke is more likely, right?
No, you are at risk for hemorrhagic stroke or embolytic stroke for sure.
Okay.
Yeah.
Gets better and better.
I know. I know. I'm sorry you don't feel well. I know these things are not good news, but it's also like you can't ignore them. You know what I mean? It's just like too directly linked to each other. Okay. Okay. Are you notice? But you do notice relationships between your symptoms and your stress level, correct?
Absolutely.
And I know like you're going down the path, like maybe this is cortisol, maybe this is the stress adrenal response, but it's also blood pressure, even though you may not capture it, that direct linear relationship all the time,
Yeah, because I was not taking my blood pressure.
Yeah. Okay. So that's one of the most important things I wanted to talk to you about. It looks like you're following all the guidelines very well. I'm glad you've got heart math and you know how to do your deep breathing exercises. And those are all only going to be helpful because the less frequently you're in a stress physiological response, the less likely you're going to have these reactions, right? Okay. I'll go over your labs in a second because your TMAO levels, it looks like it went down. Okay. Your persistent symptoms, let me just make sure. It's just the fatigue, right? Just the general fatigue.
No, I just have so many symptoms, like so many pains, so many various, like you start with insomnia, then you go into constipation and headaches and like pelvic floor pain and whatnot. It's like so many symptoms, and these pains, constant pains that are dancing around my body is just maddening.
Yeah.
And yeah.
Okay. Well, we're not ignoring that right now, but we just have to go through the steps. You know what I mean? I'm not. I know you're in a bad spot right now, and been for a while. Okay. Okay. And then the other things I wanted to talk to you about. Okay. So, do you have any? Okay. What are your current concerns? My long medical history has taught me that my main obstacle to achieving positive treatment outcomes is my extreme hypersensitivity. I believe that understanding and addressing this extreme hypersensitivity is our priority if we're successful deal with our other issues. I agree with you. I think a lot of your hypersensitivity is really due to, as you know, neuroinflammation, neurons close to threshold, so they just respond quickly with very little stimuli, and impairment of the mitochondria, where there's not much endurance, doesn't take much to fatigue a system.
So,
But we think the main cause of that is just your unhealthy blood vessels and your vasculature to your brain right now, and some underlying inflammation of those immune cells.
and what is then the treatment for these neurons close to threshold and this?
Well, first thing, there's two parts to this. First part is to reduce things that are causing the injury, like find the triggers, which you're doing some of that right now. For example, bringing down your TMAO levels, bringing down your stomach inflammation, bringing down your blood pressure. All those things would decrease the mechanism. Then the recovery part of it, we're trying to get you into like ketosis, but that didn't seem to work very well for you. And ketones like have an anti-inflammatory effect, which we're hoping to get you into fasting, but you don't have the efficiency right now to be fat adapted enough to go into fasting, so that didn't work for you. But other strategies that you may want to consider is like a hyperbaric therapy. Have you ever done that?
Oh, I'd be afraid to do that.
You would? Yeah.
Yeah, because this is too much stress for the body. Oxygen means healing, right? There are some bacteria, some microorganisms, and this is what I want to emphasize. So my understanding is that every time, because I kind of prepared the list of the things that I have reacted to in the past.
Mm-hmm.
And apart from just several lists, that's a long list. And it is in the case review.
Yeah.
Apart from several that kind of caused me a specific reaction, like if I took chlorella, I'd be throwing up, right?
Yeah.
Or with Demerol, I was throwing up too, but what is epidural made me shake. But the other, all of them, all the rest, kind of like are related to killing
Yeah.
organisms, kind of like pulling toxicity out of the cells. And this is something that I would really want to understand about my high toxicity and detoxification. Because it's kind of like I'm trying to understand it and I cannot. And I'm reading, I saw recently Dr. Connor's 7 Phases of Detoxification. I didn't work through it yet, but I'm kind of like trying to understand why is the bottleneck there. And I understand that, okay, my methylation is off, my glutathione is like completely trashed, right? One is completely absent, the second is half working, it's only one that is working. So, and with all this toxicity that got poured into me here in America, and then with all the stress that I had to go through that increased obviously inflammation, and I hear Dr. Shea saying, okay, you've got inflammation, there is no detoxification. So there's no detoxification, but there is intoxication all the time because I didn't understand what was going on around me. So I was doing all the wrong things.
Yeah.
So where is that bottleneck and how do we untie it? So, okay, you understand that glutathione, people can react to it. And it seems like I do. I didn't initially, okay? Because I remember I went to Dr. Darvish. She gave me, I think, 3 glutathione IVs. It was after the third that I got completely confused. And I remember I don't know how old my son was, maybe 8, maybe 9. He told me, Mom, you missed the turn.
Yeah.
I did not understand that I did because there was so much going on in my head, and that was it. And then later on, when I started oral, it increased my symptoms.
Right.
Okay? Same with methylation, it's not as pronounced, right? So maybe if I felt stable enough, stronger than I am now, and then I increase it very, 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 very slowly, maybe I could master it. But do you understand why I'm reacting to them?
Well, it's not okay. Here's the thing. If you read about detox toxicity, you would fit into that world. If you look at all the symptoms of mast cell activation and mold toxicity, you would fit into that world. And quite honestly,
everything bad is mine.
No, that's the way it is, because you have diverse. Anytime someone has diverse symptoms that are unexplainable by a disease condition, you can explain it by toxicity, you can explain it by mold, immune reactivity, even going to the mast cell thing. So if you read about it and overlap with your symptoms, go, oh yeah, I must have that. And that's where things get frustrating. And if you went to like a mold person, you're being diagnosed with mold, whether all the tests are negative or not. And that's the difficulty with it. So the issue is like, what do you do? What are the chief diagnoses and how do you deal with it? Now, listen, I work with mold toxicity patients. I work with people that have chemical toxicity exposure, and we have to help them through it. And I work with people that have neurological issues. So I have experience discriminating between them. Okay. So listen, when I got to work you up, you had such significant neurological deficits in your exam. You had like palate paresis, you had upbeat nystagmus, you had ataxia. You can even hear in your speech how your motor system's not working. That's injury to the nervous system. Okay. Right. And technically the mold rule is like, yeah, mold can destroy the nervous system, blah blah blah. So it could all be mold. And then in reality, people that have these kind of neurological diseases, they go from like the mold expert to the detox expert to the mast cell activation syndrome, and this whole time the brain gets ignored and the brain keeps getting injured and injured. And that's what I'm worried about with you. Okay. Now, when there's some degree of neuroimmune compromise, you do become sensitive to lots of things, and your body's autonomics become dysfunctional. You're you may have you may have some detoxification issues, and you may have some antioxidant depletion issues and methylated issues that only are making some of these things worse. But you're gonna waste. I think you're gonna waste a lot of time trying to trace some of the things down here, like and avoid your microvascular disease. Okay. So let me go over a few things here. You said the following are the possible hypersensitivity root cause that I've learned about so far. Microglial activation. So I definitely believe you have that. Okay. Mold toxicity. Now we did check mold antibodies with you for IgE, which is like mold allergy. We didn't check mold IgG antibodies. It's possible you have some immune reactions to mold. Okay.
I do, and Dr. Parpia checked those, and I reacted to many, but she said that it was insignificant.
Okay.
I do not know any better, but that's what she told me. But I did react to many. I did.
Okay, so then don't get exposed to mold, damp areas. Make sure the humidity is okay. I mean, we can put you in a mold. If we put you in a mold-free environment and put you on a bunch of nutraceuticals to deal with mold in a tiny room for the next 4 months, do you think you would actually get better?
I don't think mold is the only thing that bugs me.
Exactly. So, if you notice sensitivity to mold, the best thing you can do right now is reduce the exposure. We don't want to chase down this path right now when we're so worried about your blood pressure and microvascular acute symptoms. Okay. Your mast cell activation syndrome, like, I don't think you have it. I mean, people that have mast cell activation syndrome, they usually have lots of skin reactions. They have a lot of histamine responses in their skin. We checked your histamine levels. They weren't high. There's really no good test.
It's actually, until this spring, last spring, I thought, no, there's no way I have mast cell activation.
Yeah.
Then I listened to a couple summits, and I thought, yes, I do have it. Okay.
Yeah, that's how all summits are. If you listen to any summit, by the time it's over, you think you have it. That's normal.
Well, not quite. So it's also that histamine was high when I did one test with Dr. Standison. And recently, Dr. Carnahan, you know her, she speaks about mast cell activation syndrome on summit, and looks like she dealt with it herself. So she kind of like has this criteria, and it was tyramine. She was saying she's checking for mast cell activation syndrome and this kind of stuff.
Serum tryptase, you mean?
Tyramine, I think.
Okay.
I can send you her criteria. So maybe we can check at some point and figure out whether this is what it is.
So, there's 3 main lab markers for mast cell activation syndrome that are typically used in combination with several events that happen and symptoms for the accurate diagnosis. In the standard world, it's very hard to diagnose with any kind of lab test. You're not going to get a black and white answer with it. But typically, you would have severe skin reactions and other mechanisms.
Yeah, and that's why I thought that there's no way.
And the other thing that would be very diagnostic is if you took like a histamine blocker, antihistamine, and you would notice in some change in your symptoms. Have you ever done that?
No, not really like that, because what they were offering quercetin, I react to quercetin. Obviously, I have some genes that react to that. Then I tried one of my kids' antihistamines, because both of them have allergies, true allergies, IgE. And the way it made me feel, it's like, I took it to deal with insomnia. It's like I was trying to walk over threshold and I couldn't. It kind of made me fatigued, made me feel like lethargic, but I couldn't get to sleep. So that's all I remember about that attempt.
Yeah. Well, let me tell you, like when we have people that actually have overactive mast cells, almost anything we check IgE, doesn't matter what it is, shows positive. Like they have polyreactivity. And
Okay.
then you don't have any of that. And
I
then
don't
when we check their serum histamine levels, like it's off the charts.
Okay.
And yours are normal. I don't know. I just think you kind of got
But to relax.
wait by the summit, you know.
No, I kind of like try to analyze.
Sure, you can try to find antihistamine medications you want to use, or and basically go on a low histamine diet and see if anything changes. I don't think anything will.
And I was trying to look at like spinach high histamine. Do I feel worse after I eat a lot of spinach? No.
I'm just saying it's not. You know, these are, I think, distractions.
Yeah, well, do not know. See, my understanding is this: like my disease is kind of like this ball of yarn, and
Yeah.
you have to unravel it. You have to find that end of the beginning of the thread. If you pull it anywhere, it just makes things worse. But how do you find that end of the thread to start pulling?
Yep. I can tell you right now, your clinical symptoms and diagnosis is very clear. Listen, I'll put you right here. I literally was able to take every single one of your chief complaints and directly related to the specific blood vessel branch.
Okay.
So I mean, it's hard for me to say like, oh yeah, I really think it's not that. I really think it's mast cell, even though you have no elevated histamines and no severe skin reactions and other pans. I mean, I've seen mast cell activation syndrome patients, you know. So I can only give you my view and my bias, you know, and ultimately you got to figure out, you know, what the best approach is. Now, emotional trauma for sure, I think is related because it elevates your blood pressure. You know, high toxicity intoxication. I'm sure you have some issues with inefficiency in this pathway.
Yeah, I wanted to talk to you about these GPL talks, and you give me your opinion. It's like I feel like I want to repeat this test, and I did it in May last year, and it's just so high. Everything is so high out of all of them. You're familiar with this test, right?
What test was it, Vera? What was it?
This is Great Plains GPL talks.
Oh, yeah. The pesticides and all those, yeah.
Right. It's like most of them are elevated. Three or four of them are higher than 95%, and the rest are higher than 75, and it is like 2 or 3 that are normal.
Yeah, I mean that's definitely not good. I definitely think you have layers and layers of stuff for sure, like in your history. And obviously, if you have like a chemical overload, and you have some issues with, you know, your gut being ideal functioning, and you have, you know, some of these subtle imbalances, it does put you in a vicious cycle. But the question always is back to like, what can you tolerate? What can you take to reduce them? You know?
This is it. How do we approach it? How do we find that end? Because if we pull in the middle, it gets tangled, it gets worse. So how do you find that end that we start to unravel this?
Yeah. So for me, my immediate goal is try to go, what's the actual diagnosis instead of like theoretical worlds of nutrition and alternative medicine? What's the actual diagnosis? By doing a very thorough examination and routine lab and just seeing what's there. Okay. And you have not had that done. I have looked at your medical history, and you have very clear neurological deficit symptoms. You have dysarthria. You can hear your dysarthria. And it fluctuates different times we talked.
Not that I didn't try. I saw 4 neurologists recently.
Yeah, but you got a quick like in and out kind of visit kind of thing. They didn't do the You told me.
They didn't do the job, and I have no way to know. This is such a deep expertise that
Yeah.
no lay person can get it or just
Right.
on it and whatnot.
So Vera, I think the diagnosis is correct right now. I just don't know if the treatment applications we have just with using nutraceuticals and some diet and lifestyle is going to be enough to make a change for you. Okay.
Okay.
At the same time, I don't know what your tolerance is for other therapies. For example, you talked about hyperbarics. People that have vascular injury to their brain and strokes, they do very well with hyperbarics, but some people don't. Some people get exhausted and fatigued when they do a session. But it's one of the things that may benefit some people. Some people use things like NAD therapy to really help recovery from an injury. It's an IV. I don't know how far you want to go. Sometimes people that have lots of impaired detoxification issues do really well working with a homeopath that can kind of help clear those things. So those are all things that are interventions that are outside my spectrum of treatment tools because I stick with diet and nutraceuticals and some lifestyle change. But that's where we want to kind of, if you're going to go in that direction, we can kind of figure out through trial and error what works for you or along that path. But right now, the single most important issue, I think, before you get too far gone with other esoteric things and well, not esoteric, but to different therapies, is just to ignore the leading cause of microvascular flare-ups, which is high blood pressure. Do you know what I mean?
Okay, let me understand this part now. So I understand that obviously I might need to see some allopathic doctors. Is that what you're talking about?
Yeah, I think you're too far gone. There's too much of an acute, immediate concern for you to just like take magnesium to lower your blood pressure or something like that.
Well, I'm taking so much magnesium, like six pills a day to deal with constipation. Obviously, this is not something.
I know. And you're extremely sensitive to lots of different supplements and it's like these signature attacks I think are very serious.
Okay, so my medical doctor, general practitioner, is sending me to vascular neurologist. Is that the specialist I need to see?
Yeah, you could see them. Here's the thing. The problem, you definitely want to get evaluated by a neurovascular specialist. Neurovascular specialist typically sees like very severe strokes, and they traditionally don't value microvascular disease as much as severe strokes. So they kind of like, yeah, microvascular disease, you have some hypertension, some of these things. So be prepared for that, but definitely get an evaluation and see what they have to say.
Okay. And what other specialists do you think I should?
You need to get your blood pressure under control. You need to get constant monitoring of your blood pressure and figure out what it takes for you to lower that.
Okay, and this I can ask of my general practitioner to do that constant monitoring.
Yes, whether they do it or refer you out to cardiologist would be ideal.
Okay.
Most neurovascular specialists are not really dealing with microvascular disease. They're just really dealing with massive strokes but you definitely should still get evaluated.
Okay, and so a cardiologist?
Yeah.
This neurologist, who else do you know of a doctor that can comprehend the whole thing, the whole bouquet? I'm holding, okay, I have these neurological deficits and I have this risk, but I'm also very sensitive. So how do you treat me?
The problem you're going to have is you're going to walk into the healthcare system and you're going to say I have these weird symptoms of signature attacks and I think I have mold and I think I have all that. And they're going to think you're a crazy person.
Yeah, I've been, yeah. So I've been sent to a psychiatrist already.
Right. be aware of that. So you might want to just go in and say, I have really high blood pressure. My symptoms get worse with stress. I'm concerned about my blood pressure and my MRI findings of microvascular disease. Don't start talking about mast cell activation syndrome and mold toxicity and
I actually did go that route in the very beginning because I was told I have chronic fatigue. So I thought, okay, I'm going to Swedish center, and they are doing this allopathic treatment, giving me this IV to see whether my cortisol rises, and it rises no problems. You are healthy, Vera, okay? And then I have chronic fatigue in test after test after test from different labs.
different story. That's all endocrinologists. That's a cortisol ACTH challenge test. That's different. We're talking about like right now with your blood pressure and your vascular health.
Yeah, I'm just giving an example of the way it goes between.
It's the healthcare system. You got to be careful. Like, just go. I would just listen. When you talk to your physicians, bring up the things that they can understand. I have symptoms that are expressed when I have a lot of stress. I've had spikes of high blood pressure. I want to make sure my blood pressure is under control. I have symptoms which appear neurological to me when I have these episodes. Have 3 MRIs that showed some macrovascular disease. What can we do to mitigate that? The only options are really going to be hypertensive drugs. It's not like you're missing out on a major treatment in medicine, you know? But you got to get your blood pressure under control, and I'm not even sure if pharmacology can do it. You have to see if you can.
Okay, so what do you think about this toxicity? It's like I'm really worried if this is coursing through my blood all the time since May.
Yeah.
What it is doing to my blood vessels and everything else, cell receptors.
It's a real concern. I mean, when you have high amounts of any kind of toxic chemical or pesticide, it's not good, and your blood vessels can cause it. The question is like, what can you tolerate taking? What's your load? Ultimately, you've been in this world for some time now. You know all the different supplements for detoxification, like N-acetylcysteine, and glutathione, different antioxidants. What can you tolerate?
This is the problem.
Yeah.
But I'm just testing this theory then, because it was done in May and the war started in late February, saying March, and I was losing weight at that time. Is it possible that all that toxicity spilled out from the fat cells, and now it is not that bad? Is that a valid theory?
I mean, body fat does store toxic chemicals, and when people lose body fat, it does increase levels in the blood. It's possible. It's hard to say if that was directly related to your symptoms, but that mechanism is possible. This is the difficulty with is like the extreme amount of sensitivity you have is what can you tolerate? Like if you can't handle MSM, you can handle trimethylglycine, right? Other types of nutraceuticals like that. Those are the typical things that are used to clear out these pesticides.
But can we figure out why I cannot tolerate it and do something about it?
Some of that, like you won't. This is what's hard for you to connect because you don't see it all the time. When you start to get injury to different areas of your brainstem and your autonomic functions, these types of things happen all the time.
And tell me again, why am I getting this injury? What caused all this? I didn't have any concussions.
I don't know why you have MRI findings of microvascular disease. It's probably genes and environmental issues,
Environmental, like toxicity?
It's hard to say.
Could it be stress?
Well, listen, if you go ahead and Google what are the causes of microvascular disease, you're not going to get one answer. It's going to be like any other disease. It's a combination of multiple genes in combination with risk factors through diet and lifestyle and environment that then cause an expression. It's not like it's one thing you're going to remove and everything is going to get better. Right now, my biggest concern on going with you is your blood pressure and how extremely sensitive your episodes get worse when you're under stress. we need to kind of rule out the obvious stuff before we start to go way out there. You know what I mean?
Mm-hmm.
The obvious stuff is you have some indications of white matter hyperintensities throughout your brain that three different neuroradiologists have clarified and determined, use the term microvascular disease. And your symptoms get worse when you're under stress, which typically elevates blood pressure. You have episodes of blood pressure in the hypertensive stage when you measure it. And like we're chasing maybe other things that aren't as critical. We just don't want more and more injury. The more injury you get to your brain and brainstem, the more difficult it is to untangle everything, you know?
Right.
And then at some point, that's not going to get you rid of your symptoms. That's just going to, so like the first thing is, do you stop the frequency of these signature attacks? And then the question is, how does the brain recover? Now, without being able to get into ketosis and without being able to do like some fasting right now, those are the main dietary lifestyle strategies. And that's where we're thinking of things like IV therapy or hyperbarics or other things to help with injury to those tissues. But you have to slow down the injury to those attacks first. Now, from a blood chemistry perspective, your oxidized LDL was okay, your TMO levels were down, you definitely need to work with things you can take to maybe lower your homocysteine more than it is right now at 11 and just continue down that path. But why don't we focus on having you work on your blood pressure? Tell me what happens with that in the neurovascular specialist. In the meantime, anything you feel like you can take for concerns you have, like pesticides and detox or whatever you want to do.
Can you write that down for me? What you think might help me? Like you're saying, glutathione, NAC, and stuff. MSM you mentioned, right? I have all of them. I bought them, but it's just
all of them. You can, sometimes you're sensitive to them, and sometimes you're not.
Mm-hmm.
So you might experiment with the dosage. You may be able to tolerate things at different times.
Okay.
You also may consider other things like can you handle saunas?
Nope.
Your autonomic function is not there.
I was even trying 1 minute, right? I used to push it, like I really tried like 10 years ago.
Yeah.
But constantly make me so much sicker, so I stopped. I have one at home. I have everything, can't use anything.
I know. I understand. Listen, the biggest, like, we're on different sides of this. You're suffering from it, and I'm kind of looking into the mechanism of it. For me, from my point of view, it's like I'm worried about you progressing faster and declining and having a massive stroke or something.
Well, I'm going to make sure that if I do, that they put me down.
Okay. Your side of it, I know you just want to get better. You just wish you could just detox. You wish you could just take some things, and I understand that. Can you basically keep me in touch? Like, let me know the next couple months of what's happening with your blood pressure monitoring, and maybe we should just try to connect in 2 to 3 months, see how things are going. For the most part, you're doing everything that you should be doing from our initial plan. We kind of look at, I'll show you here. The first goal is to optimize vascular health and reduce expression of microvascular disease. We're still in step 1. And I think blood pressure is a big part of this. You weren't able to really handle the ketosis right now and the autophagy removal, which was these stage 2 and 3. And then we talked about compensatory support for GI function due to lesions, lower brainstem, brain gut axis, and those types of things. Like, I'm not even sure if you can tolerate much of that right now. And then, whatever, these are the supplements that you were already taking. Those are still good to take.
So do you want me to get back on fish oil, or should we do another test?
Don't do the fish oils just because your TMAO is so destructive, and is elevated. I would stay away from that still. But we can do some further testing down the road. I think it's just a little bit too early because the essential fatty acid profiles are done with red blood cells. They take a few months to change. Mm-hmm. And, the other thing we talked about is, thinking about your hormones. Hormones can play a big role in your recovery and your
Yeah,
brain.
and can I ask you, I know obviously our time is up, isn't it? Because I started progesterone, but I'm afraid of estrogen because of the pelvic floor cancer running in my family.
Yeah.
And do you know what testing I could do to make sure that there is no cancer growing? Will non-contrast MRI, pelvic MRI, do the trick? And mammogram?
Yeah, I mean, you can do it through like liquid, you can do it through like a lab test, like you can do a liquid biopsy test to look for cancers. It's about $1,000. It's called a Gallery test. It'll screen for DNA fragments associated.
Yeah, I know what you're talking about. I got that course you were teaching,
Yeah.
but it's $1,000 and it's out of pocket. But like MRI, non-contrast would not tell me enough, and
Well,
mammogram.
your MRI will be able to tell you if there's growth, but not early cell changes.
Okay,
If there's
and
anatomical change, your MRI will catch that. If it's happening at a cellular level, you
not
won't
yet.
be able to tell it without blood. Ultimately, it's not going to be cheap testing, whether you do a non-contrast MRI or the other test. So it's just a matter of cost benefit to you.
Yeah, yeah. I wish insurance paid for that because my case is the one that.
We're the same. Like I know our friend, like I have to budget testing for my wife and myself every year, and it's like, wow, this is terrible. We don't have a healthcare system that recognizes these tests. Anyways, listen, the main thing we're still like in this the first goals is your vascular health and blood pressure is still at the top of the game here. We're not seeing much change with that, and it's where you need to focus some attention on.
Okay, do you want me to write you any weekly reports?
Yeah, can you send me updates of what you're doing with that and what happened? We got to get you evaluated with that. You're okay with considering pharmacology to lower your blood pressure to see if it helps
Yeah,
you?
yeah, I'll talk to I don't know what do I need to go back to the practitioner or the vascular neurologist will tell me.
You're probably gonna have to go to your general practitioner for your blood pressure management, you know?
Then I schedule.
Listen, I went to the dentist, my blood pressure is 170. I went to I've had to check my own blood pressure. Here's my journal, the one he showed me. I'm seeing hypertension throughout the day. I really want to get this under control. What are my options here? What can I do? Do I want to monitor this for 24 hours or not? Some will, some won't. But that's like your most important initial step. Okay. And then go from there.
Okay, I will.
Okay, Vera. Keep me in touch. Let's see how this goes. And hopefully, getting your blood pressure down may slow down the frequency of your signature attacks. That's the first thing to really figure out.
Okay.
Okay.
Thank you very much.
Thank you. Bye.